Healthcare for all, rich or poor, young or old, in times of sickness and in health, free at the point of delivery. These are the principles, not just of Britain's National Health Service, but of a workers' medical aid society nested within a humble Welsh valley a generation before. From the men in the pits to the local businesses that served them, funding for this truly altruistic cause came from all sections of the community of Tredegar. The son of a coal miner and a product of this community, Aneurin Bevan was a visionary who transformed this model from his hometown into the most far-reaching piece of social legislation in British history, touching the hearts of a nation. To his contemporaries, it was said that whenever Aneurin spoke, they felt as if they had heard a preacher, with a rare gift to inspire and uplift. Nye was a mesmerising orator. Hearing his words echoed in Parliament as an MP, few could have suspected that he was born with a speech impediment, tamed through diligent practice and reciting long passages by the poet William Morris. But for all his powers of persuasion, the road to founding the NHS was a rocky one, paved with vigorous opposition from the British Medical Association. However, in the most testing times, Nye proved himself an astute political operator, striking the balance between principle and pragmatism. With the NHS finally approved, he marks history with this open letter to the medical profession. On July 5th, we start, together, the new National Health Service. It has not had an altogether trouble-free gestation. There have been understandable anxieties, inevitable in so great and novel an undertaking. On July 5th, there is no reason why the whole of the doctor-patient relationship should not be freed from what most of us feel should be irrelevant to it, the money factor, the collection of fees, or thinking how to pay fees, an aspect of practice already distasteful to many practitioners. The picture I have always visualised is one not of panel doctoring for the less well-off, not of anything charitable or demeaning, but rather of a nation deciding to make healthcare easier and more effective by pooling its resources, each sharing the cost as he can through regular taxation and otherwise while he is well, and each able to use the resulting resources if and when he is ill. Let this be a truly national effort. Authentic as it was innovative, the foundation of the NHS is remarkable for growing out of the experiences of ordinary people who didn't need to be told what was good for them. This letter highlights the qualities of its architect, whose first instinct is not to be divisive or bitter to those who opposed the idea which he championed, but to mobilise them behind a common national mission which they would lead. As Nye would write, "We have been the dreamers, we have been the sufferers, and now we are the builders." Himself later a victim of the black lung disease catalysed by his adolescent work in the coal mines, there is a sad irony to the fact that the man who redefined possibilities for the sick of Britain died of a chronic illness. More than a public servant, Nye was a friend of humanity. Aneurin Bevan with a letter for the ages.